Hi, John here for Total Health Magazine, Total Health Television. I'm with Dr. Mimi Guarneri, author of this great book, The Heart Speaks. And I picked this up at the conference, at the Scripps conference, and I was reading it. I was just glancing through it because I was going to be coming to talk to you, and you started talking about imagery, and we have actually in the magazine. If you actually on Total Health, I'm sure you've been too busy because you haven't to do this, but when you do, you'll see how many articles we have on the topic on eidetic imagery.
Great.
And you're speaking to the converted.
Okay.
So how did you, as a cardiologist, come to be inspired to write a book about the heart from this perspective?
Well, you know, it's an interesting question because when I was first thinking about writing a book, I spent about a week putting together a little outline of the classic things that people write about, right? So people write about cholesterol and they write about inflammation and heart disease in women. And I found myself so bored at the end of the week that I thought, I can't do this. But I thought, what's really meaningful to me? And I thought it's my patients' stories. Mm-hmm. And the beauty of The Heart Speaks is that it's true stories of my patients, and with the hope being that when you read someone else's story, that you have a glimmer of hope for yourself, for your loved one, for your family, and it touches on all of those areas that Western medicine never talks about. Mm-hmm. So there are stories there where someone's depression was relieved when she got a dog. There's stories there about corporate executives who had heart attacks while speaking on the stage, changing their entire life. Mm-hmm. You know, stories about stress in the heart, grief in the heart, depression in the heart, all the emotions, or connection, all of those things that sort of got tossed to the side that no one talks about. And we know that depression, social isolation, hostility and cynicism, loneliness, these are all independent risk factors for health. Right. And yet everyone talks about cholesterol and diabetes and blood pressure, which are important. Yes. But the others are as important as well. So we tend to be one-sided in our discussions. And the name The Heart Speaks actually came from one of my patients because if he would start to have a skipped beat or develop some tightness or pressure in his chest, what we call angina, he wouldn't call and say, I have chest pain or I'm having a problem. He'd call and say, hey, Dr. Guarneri, my heart is speaking to me. You know, and it does, right? So the heart can be broken. We now call it broken heart syndrome. The heart is affected by the full range of emotions. Yes. And so that's really what the book is about. It's about true stories, real people, how people's lives were transformed through the events that occurred in their life, the people that they met, the changes that they made. And my hope for the book was that someone can pick that up and say, hey, if he did that, I could do it. Right. If she did that, I can do it. Right? Right, of course. And that's what it's about.
Gives people hope.
And that's all we all want, right?
Yeah, it gives people hope, and they're great stories.
Oh,
so they're just great stories.
I'm glad you feel that way.
So I was very happy with that. So The Heart Never Speaks. Now you're writing up a second book?
I am. It's actually my third book. The other was a book for physicians and clinicians, but it should be out by the end of this year. And the working title right now is 108 Steps to Unleash Your Healing Potential. So it's a book that you can open and read a step, and of course the 108 comes from the prayer beads from the mala that comes out of Buddhist tradition, and so that's the symbolism of the 108. Okay. And anywhere you open the book, there's a pearl, you know. And our center here in La Jolla is named Pacific Pearl La Jolla, and the reason we like the metaphor of a pearl is because for a pearl to be made, there has to be irritation, pain, and suffering. That's how a beautiful gemstone is made. You know, a piece of sand gets in the oyster, it irritates the oyster, and eventually the oyster tries to heal it, and in the process, a pearl comes out. So it's our lives, right? Not everything is easy. We have to sometimes, we all go through hard things.
Yes.
But can we have a gemstone at the end
At
of
the
it?
end of
Can
it.
we have a pearl?
Right.
And so the book is 108 pearls that touch on everything from treating cholesterol naturally to decreasing inflammation to getting a better night's sleep to community to learning to breathe to mantras, you know, sacred word repetition, all sorts of things from a body, mind, emotion, spirit perspective, right? And of course integrates the health of the planet as well. So easy steps for
Easy
people
steps
that
for
anybody can follow, right?
Well,
Anyone.
and it's important too, because I mean, personally, I was in a very stressful, in the 90s, I was in a very stressful scenario, you know, building a public company and doing all this technology, and it was like going, and then finally I ended up realizing I was more interested in health, and then got into health and back to my broadcasting roots and went into radio and did talk radio and on health, a health show, and worked with the Naturopathic College in Canada. And but even doing that, I kept thinking, okay, now this is what I want to be doing. And it was just recently I found out that I'm actually under so much stress now, and I forgot to take time for myself.
Right. That's exactly right. So when you go on the airplane and they say if the oxygen mask falls, who do you put it on first? Yourself, right? We tend to be doing too much and not letting the urgent get in the way of the important. Right. And what's the important? Taking care of yourself. Right. Because if you don't, you can't do anything.
But my point is, I never realized that I was doing this. And I bet most people don't.
No, they don't.
Most people don't. You know, especially when you get into your middle ages and you're still working, your kids are still in university, and you're doing all this, and you might think everything's okay.
Until it's not.
And when it's not, it's really not.
Right. And I have many of those stories that I tell in The Heart Speaks.
Yes.
You know, we tend to complicate our lives too much. And I would invite everyone to think about, how can I simplify? How can I save a little bit more money? How could I, because most of the stress I see that people have, it's around finances, right? It's around relationships, right? With their children or with their spouse or with their ex-spouse, and really looking at how can you heal some of these things, because this is where most of the stress comes from. And I think in many ways we've supersized our lives, right? We didn't just supersize food, we supersized cars and houses, and it's like more is better and consuming is better. And what we end up having is, you know, big houses and 3 cars, and we're not even home to enjoy it because we're too busy being outside trying to make money and maintain it. Does that make sense?
You know, I spoke with a woman yesterday that was at the conference, and she was Persian, but they had moved to Colombia. They were living in Colombia, and then they moved to the U.S. And her son one day said to her, I can't remember how old he was. I want to say 7. He said, "Why did we move here?" And she said, "Well, we better opportunity, more opportunity, and learning." And he said, "Well, but nobody's happy here." He said, "Everybody has a big house and lots of cars, but nobody smiles." He said, "Mom, remember how happy we were in Colombia when we had so little?" 7 years old.
Well, what do we say? The wisdom that comes out of the mouth of babes.
Yes.
Right? And I'm afraid that it's true. You know, we had the breakdown of 3 generational households. You know, when I grew up in a community where everyone knew everyone's kids.
Yes.
Right?
Yes.
There was I could go into any neighbor's house and they knew who I was, and So there was real sense of community, right? Families lived together. I had my grandmother, aunts and uncles, my brother, everyone was coming together all the time. And now we have these silos, which I really believe create a lot of stress. People living 3,000 miles from their parents, children come home from school and there's no one there because both parents are working.
Right.
I mean, it's to me that going back to the concept of the village, right? And how do we begin to get back to that?
You know what I do? I just started doing this. It's great. I like to cook. And of course, with the magazine, I do a lot of testing. I get products sent to me. I get things sent to me all the time. So one of the things I started doing recently is I would make a big pot of organic soup of some kind. Like this weekend, it was spinach and vegetables, carrots, celery and stuff.
Great.
And lots of garlic. I like garlic. So if you don't like garlic, don't move next to me because you're not going to be one of my testers. So I make so much. There's no way it's consumable.
Right.
And then I have a whole bunch of glass things and I fill them up and then I start calling my neighbors. I'm like, hey, would you do me a favor? I made too much soup. Would you like a big thing of organic soup? And so like last weekend was lentil. This weekend is vegetable. I've been told now I'm getting quite the reputation for my soups.
Right, you're the soup man.
But everybody's talking.
And that's the beauty of it, right? I mean, how do we begin to start to help each other, right? How do we begin to start to realize that life is short? And how do we start to take care of our resources? How do we not waste resources? How do we start to take care of each other as a human race?
Yes.
And so to me, this is what's important, is this community and social contact and not being home alone. Satchidananda said the W-E in wellness is we, and the I in illness is isolation. And I really believe that.
Yes.
I really, I see it every day in my practice.
Yes. Yeah, it's I like the dog story because this morning, actually, on my way, I went up to Lake Forest for my vitamin C IV and 5 bags of it. I feel great, but I stopped at a fishing store. I had to go talk to somebody, and they have these 2 little. They're those dogs that I can't remember which movie Will Smith was in, but it was one of the dogs. It was the aliens, one of those really flat.
Oh, I know what you mean, like a pug kind.
Like a pug.
Yeah.
And there's 2 of them, a white one and a black one. And every time I go in there, I just want to go there to see these 2 dogs.
Yeah.
They just have so much personality. One reminds me of Winston Churchill, like he should be smoking a cigar.
Wow, that's funny.
And I talk to them. I go in, I go, oh, you're here, great. I got a plan. And they go, okay, let's go. They follow me, and they sit in the corner, and I'm like, okay, here's the plan.
Oh, that's so funny.
And they're like, okay.
Listen, you know the saying, dog's a man's best friend, right? And of course, it includes cats, and it includes horses, and it includes all of...
And birds. My mom's bird tequila.
Absolutely. So all of these pets are unconditional love, right?
Yes.
And I think that it's very healing for anyone to have this in their life.
Yes. Well, just look what they do when they bring animals into hospices or children's hospitals.
Everyone's happy.
Everywhere. Everybody is happy.
The staff is happy. The kids are happy. The parents are happy. Everyone's smiling, right? It's like shifts the entire energy of the hospital.
Yeah, I saw a great, there's a lot of, obviously, apparently cat videos are the favorite on YouTube, but my favorite actually was a baby elephant.
Oh, wow.
There was one with this woman. I had no idea where it was taken, but it was just this baby elephant, and he kept rubbing her and just rolling on her and hugging her, and it just, this went on for like 3 or 4 minutes. He couldn't just...
Oh, that's great.
It was just, really and she was
sweet.
hugging it, and then he'd turn around, and he'd like this.
Yeah,
it was really endearing.
That is wonderful. Yeah, they love to be stroked and petted. Elephants are special in that way.
Aren't they, though?
Yeah.
They certainly are. Well, great, Mimi. I know you're very busy.
Well, it's thrilled
Thank
to
you.
be here. This
Thank you
is
for
great.
the time that you've given us today, and we'll be talking more in the future.
Oh, absolutely. I look forward to it. Thank you.
Dr. Mimi Guarneri, this is her book, I guess you could call her colloquial book, as opposed to her book for physicians. Pick it up, The Heart Speaks, wonderful stories in here. And as soon as your next book is ready, when it comes off the press, we'll be on top of that.
All right, that sounds great.
We'll get back together with you. Well, we'll be talking with you long before that, but we'll
I hope
promote
so.
that book, okay?
Terrific.
All right.
Thank you.
Thank you, Mimi.
Appreciate it.
I'm John. Let's go back to the studio.